Welcome, my name is Mary Wekesa. Stakeholders in the health sector are calling on the government to fast-track and fill the funding gap left as a result of the United States aid freeze. The Ministry of Health predicts over 58,000 new HIV infections by the year 2030. HIV support NGOs says they have been forced to cut down on their staff, with some staring at a possible shutdown.
Our funding came from USAID and Pepfar, and the USAID funding was to support orphans and vulnerable children in Kilifi and the environs. So as we speak, the stop order has affected us as WOFAC in that we have 34 staff who have been laid off from work, and these staff work directly with the communities to make sure that orphans are taken care of.
Now, the sputum sample transportation is not happening, and we know, for you to know if somebody has TB, you have to test the sputum. So if samples are not taken to a place where they are supposed to be tested, that means you will not know who has TB and who doesn't have TB, which means that the infection continues to spread around the country. And we had made gains in terms of reducing the TB infection, but now with this stop work order in the funding freeze, there is a possibility that we will not know who has TB, and TB will continue spreading.
The Ministry of Health says the fund freeze will also affect laboratories' transportation of CD4 testing done through lab networking, among other services. ARVs are currently available, but the challenge right now is lack of trained healthcare workers in the HIV sector to give them out.
With the integration of services at the health facility, it will become very difficult for people to actually walk into the facility and get their medication because there's no confidentiality. And you don't want to go and queue there and they start asking you, Dorothy, you're the one picking ARVs, please come to this window. I mean, some of those things will stop people from going to pick their medication at the facility.
Stakeholders are now calling on the government to act swiftly and salvage the situation.
We may not feel the impact actually right now, but months to come, teenage pregnancies, new infections among young people, some of the TB infections might go high, malaria, what happens to many women and children who access this support. So there is need to put our efforts together now more than ever, to not work in silos, but to really synergize our work and everything that we do to be able to come up with a way forward.
Temporarily allows self-saving HIV drugs to continue being delivered. The impact of this executive order is already being felt across the globe, including in Africa, where Pepfar funding has been integral in controlling the HIV/AIDS pandemic.
As we said, for commodities, 24.9 is by U.S. government, 79.8 to Kenya, and 79.8 health commodity need. That is 24.9 out of the 79.8 commodity need.
The recent stoppage of work order by the United States government has exposed our over-reliance on external donor funding for key health programs.
Our objective as government is to make sure that no decision that is made by our development partners affects the quality of healthcare we provide to the people of Kenya. So we're making all necessary contingency decisions and arrangements to ensure there will be no disruption.
If Pepfar funding ends when the waiver expires or resumes, but doesn't allow funding for services to all key populations, this will have severe impacts on those in the continent living with HIV or at risk of the infection.